Good morning and welcome to our virtual hub live today. My name's Claire and today I'll be joined by Linda Graham, who is the clinical lead for mental health and learning disabilities, and Wendy Callandar, part of Wellbeing Works. Now today Linda and Wendy will be chatting to us about their future plans for crisis hubs in Dundee and also about the mental health charity Wellbeing Works. Now, as always, if you have any questions or comments about today's live hub, please pop it in the comments section below, or you could direct message us as well, and we'll try and get around to answer your questions at some point today. Any links discussed on today's virtual hub will be available on our social media pages and also at the Cares of Dundee website. Now, at this point, I'd like to bring on our guests today, Linda and Wendy. Good morning.
Good morning, Claire, and everybody who's listening.
Lovely to see you both.
Good morning, everybody.
Thanks for joining us today. I know there should be quite exciting topics and chats, I think, today. I think following on from Mental Health Week a few weeks ago, I think it'll be good to hear about what's going to be going on in Dundee over the coming months anyway. So thank you again. Now we're going to start off with Linda today. So Linda, would you like just to give us a bit of an intro about yourself and your role, please?
Happy to do that, Claire. I think I spoke to this group last about exactly a year ago. I think
you did.
Topic. So hopefully I'll be a known face to some of you. So I'm Linda Graham and I'm currently the clinical lead for mental health and learning disabilities in the Dundee Health and Social Care Partnership. So I've got a pretty broad remit and I'm a clinical psychologist to my own training. So I'm here today to talk to you about our really exciting developments about people experiencing emotional distress.
Yes, and I'm looking forward to hearing all about it with Linda. And I believe you've got a presentation for us today, is that correct?
I do indeed. I'm going to keep that as brief as possible and make sure
that's
that
okay.
I have plenty of time for any kind of questions that pop up in the chat. Grand, so I can just make a start. So as I say, I'm really pleased to be talking to everybody today, to be able to kind of provide some information about our plans for responding to people experiencing emotional distress. If I could have the next slide, please. In our current landscape, we know, because we listen to people, so we know that our current landscape, the picture isn't as tranquil as the one that I've put on here. And I think the reason for that is because we've never been really explicit about differentiating between what I would describe as people experiencing mental health or an acute mental health crisis and people experiencing emotional distress. And what I mean by that is an acute mental health crisis where the solution to that lies in specialist mental health treatment, and an episode of significant emotional distress where the solution lies in a compassionate response followed by a problem-solving approach to make sure that people have the resources to deal with the problem that gave rise to the distress in the first place. Now, even beginning to talk about those two things, for me is quite an important thing, because historically what we've always done is speak about people in crisis. And obviously we end up in crisis for a really kind of wide variety of different reasons. And this is a really important split, I think, for us to be able to make. And the reason it's important is because different problems have different solutions. And there's a really important message in the bottom of this slide, which is that whether a person is experiencing an acute mental health crisis or is experiencing really significant emotional distress, those two things need to be seen as equally valid, equally deserving of help, and that we put the same amount of energy and resources into helping people regardless of what the cause of a crisis may be. So could I have the next slide, please? So what I want to talk to you about today is our plans for the second component of that, our plans for helping people experiencing emotional distress. And these plans reflect our Dundee Mental Health Strategic Plan, which started a couple of years ago and runs for a 5-year period. But there are plans which are linked to the Tayside wide review of crisis and urgent care. And that means that we will very carefully knit together those two components to mean that there are no gaps that people can fall through. But I want to provide some assurance that these plans are all co-produced and will continue to be co-produced by service users, by carers, and by a wide range of other invested partners. And our primary hope in the work that we're doing is that we will simplify how to access help. And we'll simplify how to access that help at the point at which people need it most. Now, we all know the difference between our ability to think and plan when we're in a calm and safe place. But we also know that our ability to think logically and make good plans are really, really affected when our emotional state is aroused, when we're experiencing distress and a range of other emotions. So it's really very important that if we're expecting people to access help when they need it most, that is easy to do. And quite importantly, our plans for helping people recognise the wealth of resources that we already have across the city. And I'm pleased that I'm sharing this platform with Wendy, who's going to give a really kind of good outline of what even a small proportion of those resources are. So we will use those resources that are there, but we will also introduce some new ones. And if I could have the next slide. At the absolute heart of what we're planning to do, I think, are 3 different things. The first thing we're going to do is establish what we would like everybody to start calling a community wellbeing hub. And that community wellbeing hub is going to be operational and accessible 24 hours a day, 7 days a week. And that's going to be a base from which we will deliver an initial compassionate response to people and provide some of our follow-up services. The second really important component of this is that we're planning to establish a single phone number to use when in crisis. And this is to do with this idea of simplifying what you need to do in order to access help fast. So whilst I was talking at the outset about differentiating between acute mental health care needs and the needs of people experiencing emotional distress, actually people in the city won't have to worry whether they fall into one of those categories or the other. There will be a single point of contact for everybody to use, and then an initial conversation with that person means that behind the scenes we will work out which of those responses somebody may benefit most from. And our third component is our plans for community-based accommodation with support. And that will be for people to utilise for short periods of time. At the moment, we're envisaging lengths of stay no more than around about sort of 7 days. So if I can have the next slide. It follows that there's a reasonable question would come up then, which is, okay, Linda, if people can access this compassionate response quickly, what is it that's going to happen to them next that's going to make things better? And the answer is a wide range of possibilities, but all of which have at their centre this idea that we know there are resources there. We know that people could access those resources, But what we want to do is wrap some support around people to help them access those resources, and probably to be able to have a kind of targeted access to resources that are likely to help people with the problem that they're presenting with at that particular point in time. So you'll see there that we have a list that includes something called distress brief interventions, which I'll talk to you about in a moment. But some other things we've already got really well established in the city. We have a network of peer support workers. We have navigators working from the emergency department. We have social prescribers working from GP surgeries. And quite importantly, for anybody who is on our pathway as somebody experiencing emotional distress, if it becomes apparent at any point in that journey that what somebody needs is some specialist mental health treatment, it will be an easy step up into that process. And if you think about the way that we've historically organised our services, it's really been the other way round. That quite often what happens is people seek help in times of distress, and what they end up with is a mental health assessment that concludes that they don't have a mental health issue, and then there isn't much happens beyond that. So we're looking to reverse that and make sure that everybody can access a compassionate response. Some people will immediately go into the mental health pathway, but probably the vast majority of people will end up in our people experiencing emotional distress pathway, and then, if need be, we'll step into mental health treatments. And if I could have the next slide, please. So for those of you who haven't heard of DBI yet, DBI is well established in other parts of Scotland. So it stands for Distress Brief Interventions. And the good news for us is that it mirrors some of our initiatives we've already have in primary care and the emergency department. And it enshrines this principle of ask once, get help fast. And for us, for DBI, that may be accessed through our Community Wellbeing Hub, but equally it might be accessed through Police Scotland colleagues, it may be accessed through Scottish Ambulance Service. So a range of partners will be trained and able to refer people into DBI. And really what DBI is a compassionate frontline response, so listening, assessing and signposting, that it's absolutely designed to be started within 24 hours of somebody first making contact with us, and lasting maybe a period of around 2 weeks to help people link them to the resources that are likely to help them most. And that's the theme you're going to hear through most of our community developments, is how do we get people quickly to what it is that they're likely to benefit from. And if I could have the next slide. The last thing I want to highlight to you is this idea of our accommodation with support. And again, some of you will have heard of or may even have visited initiatives in Edinburgh, for example, that have distress beds. So what we're envisaging for our community beds is that this is a safe environment, but it will be a homely environment. This isn't a hospital in the community. People who need to be in inpatient care need to be in inpatient care. What we envisage for this is that we plan beds in the city within communities, so close to the places where people need them, where they can maintain links with their families and support structures, but the access to those beds will come through our community wellbeing hubs. And what we envisage is that those will be used for short periods of time. So a place where somebody can safely be as their emotional distress lessens, and it will come with an expectation of engagement in daytime DBI or other interventions. So what we want, ideally, would be for people who present in crisis, by the end of that period of emotional distress to have been helped to learn some new skills and to learn about the community resources that mean that if those are in place and people are utilising those, that it lessens the likelihood of them finding themselves in a position of high levels of emotional distress again. So these will be a really, really important new development for us. And it's something that we're already looking at community-based accommodation to try and make some decisions about where those might best be located, to ensure that when our whole system is working, our community wellbeing hubs, our community-based resources, and anybody who requires a brief stay in one of our distress beds, that people experience seamless care. So ask once, get help fast. That's what we're aiming for in the city. And if I can have the next slide, please. I'm going to stop there and hopefully come back to Claire, who will flag with me whether there's any immediate questions for me to pick up.
Hello, that was great, Linda. What a great presentation, highlighting all these wonderful things that's going to come into place over the next few months, I suppose. Is that correct? Hopefully.
Absolutely. So we're expecting some of our developments to hopefully be on stream by August, and certainly our beds at the end of the year.
Great. And I think as you discussed, taking everything into the community itself is hopefully a positive, because it saves people having to come out their own communities to find all these resources and things that are in place. Whereas if it's on their doorstep kind of thing, hopefully it's more easier to access and get that support quicker, like you said.
Absolutely, Claire. I think what we've done for a long time is we've said, here are our services, you need to come and access our services. And we need to absolutely turn that about and take what we can offer to where people are. So you're absolutely right. That's what we need to be doing more and more.
Great. And I think we'll all look forward to seeing the outcome of this over the next few months, and hopefully it's something we can kind of come back and chat to you about at a later date when all this is kind of taken off, and we can see all this happen within the communities. So that'd be good.
Absolutely. Happy to come back and report on how we're
good. Well, on the back of that, there is some. We did get this is a great news and really helpful from Jessie, but we do have a question, and it's how do carers get information about accessing these hubs?
So we're probably at an early stage at the moment. I think in the run up to the launch of the hubs, that we would be expecting to be doing a really kind of wide campaign to make sure that everybody who knows, everybody knows about the service and knows how to access it. And my links here is going to be an important way of getting the information kind of out there. But I think we need to take advantage of social media, of NHS Tayside, Dundee City Council websites. I would be happy if people were fed up hearing about community wellbeing hubs by the time we open the doors.
Yep. And I think that's something we need to continue shouting about over the next little while, just drip feeding the things that's going to be happening. And by all means, we do have great website, the Carers of Dundee website hosts a vast knowledge of services that's happening within the city. So we'll constantly be updating through there and on social media pages too. So just watch the space, I suppose, Jessie, just now, and we'll hopefully be back in touch soon regarding that information. Well, thank you very much, Linda. That was great. Thanks for being here today. Now, leading really on quite well with what Linda was talking about, I'd like to bring on Wendy now, Wendy Callandar. And Wendy leads on the mental health charity Wellbeing Works, which sounds like a fantastic facility that's in the heart of the city just now.
Thanks, Claire. I'm just going to give you a quick run through about Wellbeing Works and who we are and what we do. I'm the Executive Director of Wellbeing Works, which I have to say is a great job. It's a really exciting time in the city in terms of mental health and for our organisation too. So as a mental health charity, we support something like 160 people in the city at the minute.
Yeah.
And that support, the basic aim is to support people towards recovery and better mental health and well-being. We're based in the Wellgate Centre, as you said, right in the heart of the city. So visible, accessible, and I think the really exciting thing for us is bringing mental health right into the heart of the community with a shop window, and it's great that the public are coming in and asking questions and engaging with us, which is something that historically has never happened. So brilliant to be here. So a wee bit about our programmes. How we help people is through a range of activities. So the easiest way to define it is we've got an indoor programme and an outdoor programme. The indoor programme is traditional things like arts and crafts and music and knitting and a local history group, and just things that people can get engaged with and meet other people and come for an hour and a half of just good fun. But we'll also do things like self-management programs, learning about your mental health and well-being, learning about what works. And Linda touched earlier on how sometimes what people need is to develop problem-solving skills and to look at what are the challenges I'm facing and what are the solutions to that. We do a bit of that kind of workshop as well. And then outdoors, as we're all hearing every day about the benefits of outdoors in terms of mental health and well-being, we have our allotment on the law. We do lots of other outdoor activities through our Green Buds project, like conservation work, helping in parks, planting trees, clearing beaches, anything that helps the environment and the planet, really. And more recently, we've really developed walk and talk sessions for people. So one-to-one support, but let's do it outside and get a wee bit of fresh air and exercise at the same time. So yeah, indoors and outdoors work really well for us. And the purpose of all that we do is about helping people to connect with other people, make friends and share experiences, and just feel like they've got a bit of purpose and meaning and a sense of achievement in their lives, because we know that's what helps in terms of well-being. What we also know is that the pandemic and associated lockdown that we've all been experiencing for the past 18 months really hasn't helped in terms of helping people connect and be active and do something meaningful. So we know we've got a job of work to do.
Yeah.
Forward.
Oh, yeah, but I think, like you say, I mean, it doesn't need to always be. Sometimes people think, oh, I need to go and talk to someone, but by joining a group and activity, that peer support they're getting within that group or activity could just be all they need at times. Somebody needs at times. It doesn't need to be always that one-to-one, what people think it's all about, but just by joining the chat and, like you say, sharing experiences, that sometimes is enough at that time. So I think everything that's going on, I think it's just fantastic. And like you say, it's you could I take it as quite it's accessible because it's on it's the third floor of the Wellgate, isn't it? So it's just as you come up there. Yeah. So and what is the system for people coming in and receiving support? Is there a referral system in place, or how do people go about it?
Yeah, historically it would have been a referral process, and referrals would have come through GPs or the recognised mental health pathways through a community mental health team or a CPN or something like that. And what I would say is if someone's already connected with these mental health pathways, then that's the one way to get involved with us, is speak to your CTN or your worker and get them to refer to us. They all know who we are and where we are, and they've all got our referral forms. But I think if someone's already engaged with mental health services, it makes sense to do it that way, because then we're joining up and all working towards the same aim at the right time. So I would say if you're already connected, that's the way to go. For people who are not connected with mental health services, what I would say is give us a call, pop in, we'll have a chat with you and establish what might be the best support for you. It might be our organisation, but there are lots of organisations like us out there. So it might be that we signpost to one of our peer organisations, or it might be that we signpost someone back to their GP because what they're describing or experiencing maybe needs a GP response. But get in touch, come in. We're happy to see people.
Good. There's no criteria at all. I mean, if just come along, walk in and just have a chat basically, and then see how it goes from there.
The only criteria is that we're an adult service, so it's 16 plus.
Okay, that's fine.
That's
Great.
it.
Brilliant. Well, that sounds really good. So, I mean, where do you go from here then? Where do you go from here onwards?
So, the most exciting thing that's happening is that within the next couple of weeks, we are starting to resume some of our groups. We've been on hold because of lockdown. But over the next couple of weeks, we're starting groups again. We're going to get people in. We're going to be doing more face-to-face work with people. And for myself and for our staff and for participants, that's just really exciting. And people are so looking forward to that. The other big development for us, we've had an aspiration towards social enterprise for some time to look at how can we develop activities that our participants can get involved in that will help to support our organisation going forward. And what we've managed to do with support from the Wellgate, I have to say, is the unit next door to us, we are converting into a community toolbox, which is like a tools library. So imagine you need to fix something in your home, but you don't have a drill or you don't have decorating equipment or whatever. We'll have a resource where people can come along and borrow tools or equipment to do DIY or repairs or a carpet cleaner to clean their carpets. But it means our participants can get involved in managing the tools library, helping to maintain tools. But we'll also have a workshop where we can teach people how to hang wallpaper or how to put up a shelf or how to use the carpet cleaner.
That's a great idea.
Yeah, really excited about that. And I think for us, it's taken the notion of supporting well-being in the community a wee bit further than just mental health. It's about supporting community and tackling inequalities and trying to prevent landfill and save the planet all at the same time.
Yeah, that sounds amazing. And I think sometimes it's just these small things that can make a difference as well, isn't it? By coming and getting a carpet cleaner to do your carpets so they're nice and clean, that could just be so uplifting to somebody. And so it's good. And some people don't even know where to go for these things at times. So to have that down there as well, I take it for when are you thinking for this? Sorry, Wendy.
So work is happening on that just now. Thank you to Alexander Community Development. I've actually asked them to stop hammering just so we could do this live stream. So work's happening now. I would expect by the end of June, we'll probably be ready to go.
Very good, good. And if people want to find out more information, will that just be through your social media pages?
Social media, or come in and chat. We've got all of the work is on display next door. You can see in the windows and see what they're doing. Come and have a look.
Oh, lovely. That'd be good to make pop down myself and have a wee nosy too.
Yeah.
Oh, great. Well, that sounds really exciting. I think all the work you've got going on just now, getting the groups and that back together again, and obviously the project as well, it's going to kick off in like a month's time, I suppose. It sounds fantastic. It sounds really good. And I think we'll all look forward to seeing the outcome of all of that. And maybe with yourself, it might be a revisit again, I suppose, to see where we would take that off, maybe come July time.
To do that. Yeah.
Good,
yeah, that'd be
good.
great.
That'd be great. Well, Wendy, thank you very much for that. Thank you for being with us today. I don't think we have any questions at the moment, but if anything does come through, we will be back in touch with you. But please, if anybody's interested, please just go down and visit the guys down at the Wellgate. What's your working days down there, Wendy? Is it daily?
It's Monday to Friday, 9 to 5.
9 to 5.
Yeah, there's somebody here all week.
Perfect. Well, thank you very much again, Wendy. Thank you for being here.
Thanks for the opportunity.
No worries, I'll talk to you soon.
Thanks, Ben.
Bye. Well, I think that was a fantastic hub today, hearing from Linda and Wendy about the goings on over the next few months for emotional support is going to be available in the communities, and also the Wellbeing Works that's going on as well. So lots of things to get involved in. But if anybody has any questions, please continue to get in touch with us. We will put the questions to Wendy or Linda, and we will get back to you. You could do this through the comments, you could email us, or you could stick a direct message us, whatever suits you best. But please take the chance to go down and visit Wendy down at Wellgate and her team and see what's going on down there. So thank you again. And our next hub will be for the kick-off of Carers Week, which will be on the 7th of June, and we'll be joined by a variety of organisations across the city who will be giving us a bit of an update on the support services that are in place for unpaid carers. So until then, thank you for joining me today, and I'll talk to you soon. Bye.